A reproductive urologist is a physician who specializes in male infertility.
Meaning a urologist who specializes in the treatment and care of males with infertility issues.
I think it makes sense if you're thinking about seeing a reproductive endocrinologist to go ahead and in parallel move forward with identifying a reproductive urologist like myself.
I'm a urologist by training and special fellowship training in all things sperm. So an REI, or reproductive endocrinologist, is a physician who is an OBGYN by training and then did a fellowship in fertility. So they are specially trained in all things fertility, and particularly female.
A reproductive urologist is a physician who specializes in male infertility. So I treat patients who have all sorts of different types of fertility issues on the male side, in addition to sexual dysfunction and low testosterone.
We have to keep in mind for all couples that fertility is a time-sensitive process. And so I'm always trying to remind people that it can't hurt to be time-sensitive, to evaluate both parts of the couple on parallel tracks.
In general, we recommend having the male and female evaluated in combination or collaboratively, but the reality is that the male is really easy and inexpensive and non-invasive to assess. So getting the male evaluated up front is always a great idea.
It takes two, and so a lot of times while I'm addressing the male side of things, the female partner is continuing their workup and their diagnostics with their REI, and we're in communication constantly developing the right plan for that couple.
We try to treat couples that come in as one unit. Sometimes there are problems on both sides that can be optimized, and we like to treat them together. And so there's a lot of communication and collaboration between the reproductive urologist and the reproductive endocrinologist.
And I'm oftentimes explaining to patients that there are not concrete recommendations I'm going to make to a man of a certain age and with a certain condition. I might suggest to a couple something very different if that patient's female partner is, say, older or younger or has different medical issues. And so for me to have that complete picture, I need to be working with that female partner's doctor. And so we're constantly navigating that process with different IVF centers and different reproductive endocrinologists to make sure that we're providing the best care to our patients, but more importantly, to each individual couple.
We encourage all males who are struggling with fertility to get evaluated. One is to make sure there isn't any other underlying health issues, but also we can actually help these couples achieve their stated goal of a birth of the healthy child more easily, less invasively, and more effectively if the male gets evaluated.